Hi, I'm Tracie. I want to thank you today for joining me for a Fit and Strong class. We have a little bit of a low-impact aerobics, we have a little bit of functional training, and we do have some modifications and exercises if you are a cancer patient, a cancer survivor. We have modifications to prevent and, more importantly, manage the risk of lymphedema. So I'd like to start today with a little bit of a breathing exercise, a deep breathing exercise just to loosen up the body with some shoulder rolls, and then we'll get to our workout. So if you can just follow me, please come with your feet maybe shoulder width apart. We want to take our toes slightly wider than our feet, and then we want to soften in your knees. Now it's important here to bring your body weight back so you're in your heels. Okay, we're going to just take a big shoulder roll up, back, and drop it on down. And again, a couple more, please. Lift your chin. Now here's the breath involved in this. You want to inhale as you lift, bring them back, exhale as you drop. That's it. Now as you bring the shoulders up and back, you should feel a gentle stretching across your chest. That means you're doing it right. We never want to force a stretch. So continue to bring it gently back and down. That's it. The hands just hang heavy. Nice and easy. That's it. Let's get a couple more in. That's it. And the last one right here. Now let's slowly just bring the arms wide. Palms up, please. Now if you have range of motion, brings your arms to this level and you're comfortable, you can stay here. If you can come with me, more parallel with the floor, that's fantastic. Come with me here. Now we want to keep a soft elbow, thumbs to the back. Once again, big shoulder rolls up, back, and down. That's it. Now you want the thumbs to point to the back of the room. And I'd like you to make this move more active. So I want you to think about your biceps and tighten them gently in your thoughts. That's it. So give the arms a weighted sensation. Yeah. Breathe in and breathe out. Now make this move as big as you'd like. Right here. Inhale and exhale. Two more, please. I want you to feel the sensation of the shoulders dropping behind. Good. Now let's take our hands, one to our chest, one to our belly. All right, as we breathe in, I want you to feel the belly extend. Okay, so inhale through the nose, fill your lungs, and as you exhale, feel your belly. There you go, sink in. Try a couple more, inhaling. The chest lifts. And exhaling. You might want to close your eyes for a little bit if you'd like. If it feels good, you can go there. Now this is important here, this deep belly breathing. We want to disperse any of the lymphatic fluid that may be pooling in the torso. This is a great breathing exercise also for late at night before you go to sleep. And to just feel the belly lift and lower. Well done. Let's come back to those shoulder rolls. Come right here. Once again, nice big roll. That's it. Let's get a few in. Rolling to the back. Once again, noticing the chest. You need to have that big stretching sensation right here. A little bigger. Now I want you to focus on your chin. Please lift it so the back of your neck has that natural curve. All right? Put that neck in that neutral position, because we all know neutral means no tension. Now let's come forward just a little bit, just to go in the opposite direction. That's the way. Breathing as you go. All right, let's bring those arms wide once again. Palms up, thumbs to the back of the room. And again, this time I'm going to make these circles a little larger. That's it. Breathing and relaxing. Remember, we want to keep the elbows soft, okay? That's slightly bent. There you go. Just a few minutes here. And again, weight the arms, weight the arms. Isolate the biceps by thinking about it. Put strength into that muscle as you roll. Beautiful. All right, back to the breathing once again. One hand to the chest, one hand to the belly. Sink a little bit in, deeper into the legs. Now breathe in and breathe out. Inhaling, expanding in the abdomen, and relaxing. Let's get 2 more in, okay? There's really no beginning and no end to the breath. You want to fill your lungs, and you want the sensation of emptying your lungs. One more, please. There you go. Relax on down. Relax out your hands, relax out your shoulders. Now I thought we'd move on to a little bit of a stretching segment. Okay, it is a segment. It's a modified Sun Salutation. So I'll preview the moves. You can watch me now. I'll preview also on the profile so you can see the side view, things to watch for your lower back particularly, and for the hamstring stretch. Okay, so we'll start with our feet under our hips. We're going to breathe in, extended mountain pose, eyes go up. Now here's important here to relax your shoulders. We're going to come to a forward tip of the hips, and we're going to land in this crouching position. Now right here I want you to relax your shoulders. Quite often it's easy to tense up and pull up, okay? We want to avoid that. But more importantly, just watch me here, don't follow me. My lower back is long and strong and flat. We want to avoid this bit of a collapse, okay? So we want to keep that back flat by scooping up into the belly to keep your core braced nice and strong. We will bend the knees to a little bit of a crouch technique, and then we're going to open the knees, tipping your chest forward more into a flat back extension. It's important here to lift your chin, eye gaze forward. All right, and as we bend the knees, we're sinking our body weight back into the heels to come back up and finish the segment. All right, so if you'd like to come along with me, we'll do it together. Here we go. Feet about shoulder width, okay? And like I said earlier, bring your body weight back to your heels. Just take those toes slightly wider. Scoop in the belly, lift in the chest, lift in the chin. Let's breathe. Arms come up, eyes go up. Inhaling. Shoulders are soft. Tip forward, hands land right to the top of your thighs. Tip your chest forward, relax your shoulders. Right here, scoop that belly. All right, gently bend the knees. And gently straighten the knees, pressing the thighs back just to get that stretch in the hamstring. You feel that? Then you're doing it right. Here we go, bend back in, bringing the weight into the heels of the feet, arms wide all the way back to the top again. Inhaling as you come up. And once again, tip forward. We're going to repeat that entire segment. Hands coming right here to the top of the thighs. Shoulder check, chin check, belly check. That's it now. Bend the knees, and a little bit of a extension in the butt, push to the back wall. Collarbones extend forward so the spine is nice and long for that flat back. Bending in the knees, body weight back in the heels. You're going to drive through the floor to come all the way back up to the top. Inhaling as you come up. Exhaling as you come back down. Now every move has a breath, okay? Inhaling to crouch. Exhaling to a flat back, an extension. Inhaling to sink, weight in the heels, coming back up. As an extended mountain pose, you can take your eyes up to relax the back of your neck. Arms wide, coming back down. Sinking as you come down. Open the knees to straighten the legs. Now you never want to lock out your knee joint, so keep those knees soft. That means slightly bent. Bending again, bringing your weight into the heels. Now use your legs to push the body back up. There it is. Come on down, big dive. Rolling the shoulders back, scooping the belly, of course. Bending. Straightening. Now press your chest forward. That's it. Bending softly to bring the weight into the heels so you're nice and stable. And we'll come up one more time through to the top. And come on back down. That's it. Soften the knees to sink in. Extend the knees. Now lengthen your arms if you can. To get a little more extension in your chest. Well done. Come back down, bend the knees. Again, find the body weight in the heels so you have that solid ground to push off. And we'll finish here. So simply just let the arms slowly drop wide and to the side. Nicely done. You can shake out your legs. Shake that out if you want. I'd like to bring in a little bit of a cardio segment, a low impact movement, okay, to get the circulation and increase our heart rate just a bit. So if you want to come with me, look here. It's a simple heel tap. So we have a shifting of the weight side to side. Okay, you're going to bring the leg forward. And as I mentioned before, the knees should always stay soft. All right, that means slightly bent. And the upper body should be light and loose, so shake it out. Shoulders are soft. You got it. Now the shifting of the weight here works on core stability, you're working on coordination, of course balance with one foot off the floor, but more importantly this will really help stimulate the flow of lymphatic fluid throughout the body. That's it. So we're just going to bop to it. If you want to get the shoulders in, a little dance bit to it, feel free to go along with that. That's it, just shake it on out. A few minutes here just to get that circulation going. Yeah, check in with your breathing, because once your breathing starts to become labored, that's your cardiovascular system kicking into gear, and that's what we want. We want to use this bit to get warm here. That's it. And again, we want to land nice and soft. Okay, you never want to slam your body. Imagine eggshells. So there you go. Nice and easy onto the floor. That's it. All right, slow it down, slow it down. Come back to a stand. Here we go. I'd like to take your hands to prayer position, shoulders back and down. Now lift your chin and apply gentle pressure to the palms of your hands. And then release. Try it again. Gentle pressure. Lifting the heart, lifting the chin. And release. That's the way. Here we go. Pressing gently. One more time, one more time. Now let's come into a shoulder shrug. So it's a pulling up of the shoulders and a strong pressing down. Okay, shoulder lift up to the earlobes and a strong depression, press it down. That's the way. So now that we've had the deep belly breathing, we were able to disperse all that lymphatic fluid in the torso, whatever was pooling there. We're going to make room for any kind of drainage in the upper extremities, okay? So the fluid has a place to flow to. That's it. Let's get a couple more. Now I want you to pull up strongly, really strongly, and relax on down. Nicely done. Here we go. We're going to take the arms about shoulder level, okay? And we'll have the hands somewhat in front of the elbow and the wrist, but I'd like your wrists to be strong, your hands to be strong. Now we're going to get the sensation of taking the elbows more wide and a gentle pull back. That's all it is. Take the elbows and your thoughts wide and a gentle pull to the back. Now the first sensation you'll notice is that stretching across your chest. And that just means you're doing it right. That's it. We want to open that chest. But more importantly, I want you to take your thoughts to your behind your back, your upper back, and your shoulder blades. See if you can squeeze them towards your spine as you pull the elbows gently wide. That's it. Now imagine having a tennis ball right in the center of your back. So right here, grab that tennis ball. Beautiful. That's it. Nice and easy. I said earlier we never force a stretch, and it's so true. That's it. Now only if you can manage, and if you have safety and comfort in your shoulders, bring your hands here. Imagine goalposts, football goalposts. The same movement, elbows pull more wide as they pull back. All right, just a different posture, a different rotation in the shoulder. That's it. There we go. So look at the movement here from my side profile. See how small it is? It's very small, okay? It's not a forceful or strong pull. It's more of a wide stretch with the elbows. The direction of force is to the side walls. Oh, yeah. Let's get two more in. Beautiful. One more right here, nice and wide. All right, we'll take it down, just give the shoulders a little roll, shake it on out. Shake it on out. Now let's come back to the little bit of that heel tap, alternating of the weight shift, alternating feet. So we're shifting our body weight side to side. Like I said earlier, upper body loose, upper body light. Landing on soft knees, landing on eggshells, so we're not slamming our feet. You can smile, have some fun with this, it's okay. That's it, get a little bop to it. If you want to go for it, you go for it. And just do this a little bit till we start to feel that labored breathing. Then we know our body's working, getting that blood circulating through the body. That's it. Now you can make this as big as you like. And by doing that, you bend the knees just a little more. Yep, check on those shoulders. They should be soft. We're letting them relax now from holding them up. That's it, because we will bring the arms once again overhead. We just need to get that body warm once again. There you go. All right, let's slow it down, slow it down. This time we're going to take our hands here. I want you to roll at the wrists. That's it. So we're going to roll softly through the wrists. Chin is lifted. That's it. Now this is great to release any tension in the hand. Let's roll the opposite direction. But if you've had lymph nodes removed, or if you've had radiation to the upper extremities, your chest, your torso, into the neck area, this will greatly reduce that risk of lymphedema. That's it, and the swelling in the forearms and the wrist. Beautiful. Now I'd like you to roll once again and actually lift the arms as you do, as high as your shoulder range will allow. And again, it's a slow. That's it. And we're going to reverse the roll as you slowly lower. Yeah. Releasing all the tension in that hand. The hand carries a lot of tension. Yeah. That's it. If you need to give the shoulders a break, shake it on down. I'll preview the next move. We're going to take the arms up to what's a comfortable position for your shoulders. And I want you to think about hitting a hammer. So it's a bit of a flexion in the wrist, forward and back, forward and back. That's the way. Soft in the grip. Please don't squeeze your hand. Now check your neck. It might become tight. Okay, so if you do, just simple fix for that is just to lift the chin. All right, now once again, slowly rise, same posture. Flexing, hitting a hammer, slowly rise. Breathing through, slowly lower. Yeah. Let's do that one more time, okay? Come on up slowly. Now we want to take a look at your elbows through the corners of your eyes. This should be somewhat shoulder width. All right, so we're extending straight up and down as we do this. Yeah, if your shoulders need that break, we could take it down, shake it out if you need. There's just one more exercise, again, for that upper extremity lymph drainage. All right, so let's sink into the hips, sink into the heels, bring the arms up once again. Now I'm going to have fist squeezes. So tight squeeze and a release. Tight squeeze and a release. That's it. Yeah. Let's get two more so we have, that's the way. And continue this same concept as we slowly lift the arms, squeezing and lifting, squeezing and lifting. That's it. All the way up, as far as your shoulders will allow. And again, mindful of the arms as shoulder width. Slowly lowering, slowly lowering. That's a lot to say. That's it, till we land about shoulder level. Good job. Shake it on out. Good done. All right, let's move on here. I'd like to move a little bit more into some lower body work. In order to do that, I want to focus more into the hip socket with standing hip openers. Now, we do spend a large portion of our day sitting in the chair, sitting on the sofa, in front of a computer, sitting in a car, driving. And that position can really tighten up in the hip socket, and especially the hip flexors. And when the hip flexors, the small muscle on the top of your thigh, are tight, they tense up and they shorten. So the focus here is to loosen them up, release that tension, and to get the stretch through the top of the thighs, so we have a more normal walking gait, more importantly, but also more normal posture than having a shortened stance, okay? So we'll start here with our feet beneath our shoulders. Now, I would suggest holding on to your hips. Holding on to your hips. When you hold on to your hips, you have that comfort factor. The brain likes to have something to hold on to. All right, so the shoulders should be soft in this one. And now, it's very similar to what we did with the heel taps. It's an alternating heel lift. All right, so you might feel the warmth in the ankles. There's nothing wrong with that. Just to shift to the weight, shift to the weight. One heel lifts, one heel presses. Now, as we land soft. As we land, again, the knee also soft. Please do not lock out your knee joint. Yeah, just here for a little bit. Now, if you feel confident and you want to work a little bit more on your core and on your balance, hit those core stabilizers, slowly release the arms as you continue with the feet. All right, now always know you're safe here. You feel unstable, just drop your heel. That's all it is. It's only an inch or two above the floor. We'll stay with this move here. Now, if you notice, my kneecap and the top of my thigh is driving forward. Yes, that's it. Beautiful. All right, slowly let the hands land. All right, so we'll stand our body weight onto the left foot. All right, we need a square pelvis, so we need to be square in the hips. We want to avoid bad posture, because we're here to correct posture and postural deviations. Okay, so we want to bring it nice and square. Now, the leg you're standing on, as always, body weight in the heel. Okay, I suggest holding on for round one. Now, your right toe can come to the floor. All right, so the heel is lifted. If you can see from the profile, heel is lifted. All right, I want you to watch this. We're going to take the kneecap to a quarter turn to the side, opening in that hip socket, bringing circulation and blood flow into that area of the body. So it's a little bit of a quarter turn, and take the kneecap straight back. That's all it is. So the leg that's supporting you, nice and strong, squeeze that thigh. Stand nice and tall. Beautiful. That's it. Now, your range of motion, we can work on that. You go as far as you can. When your body tilts out of position, then you know that's where you need to stop. That's it. Let's get 4 more, so we do 8 here. Opening in that hip. By now you might be feeling that warming sensation. That's it. Nice and easy. It's controlled motion, controlled movement. Nice, come on down. All right, I'm going to switch to the other side. We're going to switch to the other side. So shift your weight to the right foot. Body weight in that heel. Feel that heel on the floor beneath you. Thigh nice and strong. Hips nice and square. Chest nice and tall. So shift that body weight. Just to toe, just for balance here. Quarter turn. Take that kneecap to the side. That's it. So the kneecap that's moving turns to the side. Now the kneecap on the leg that's supporting us stays directly forward. That's it. Usually by this round, 4th or 5th repetition, you start to feel a difference. Yeah. Be aware of your body and where your body's tight. This is a simple way to loosen it up. That's it. Let's get one more in here. All right, come on down. So we'll take that modification and we're going to increase on it. Take it a little bit more of an advanced move, depending on how loose you are and how warm your hips are. So if you want to try with me, we'll try one holding on. We're going to take the right kneecap. I want you to imagine in your thoughts a rainbow. All right? So we'll take that quarter turn, but we're going to lift it up and take it wide. So you'll have 1 foot off the floor. And once again, we're working on coordination and balance for this one. So shift your weight to that left heel. Stand tall, hips square. Slowly, again, it's only an inch or 2 off the floor, right knee up, and tap it wide. Up, and reset. Again, take the right knee up, and tap it wide. So like I said, it's about control. You want to think about what you're doing. It's just a little bit of a variation on the move that we just did. Yeah, let's get 4 more in. And anytime you take that 1 foot off the floor, those core stabilizers have to kick in. Keep that body safe, keep that body steady. That's it. So it's like a lot happening here. Don't underestimate this. 1 more, please. All right. Now look here. Roll out this ankle. So important. All right. We'll just get to the other side when you're ready. Stand tall. Body weight in the right heel. Posture check. Shoulder check. Smile check. Here we go. Think rainbow with the kneecap. Up and over. Up and reset. Now you might notice a difference between your 2 sides. If you're right-handed, left-handed, you're more dominant on one side. Might be an easier movement pattern for you. But every day is different. That's it. Carefully. Just 2 more again. You can make it as big as you like. You can make it as little as you like. And if you do need support in this, you can always do this in the kitchen counter, holding on to the kitchen counter. Nicely done. We'll shake it on out. Shake it on out. Let's come back once again, just to loosen up the ankles and just to keep the flow moving through the body. So we'll start with the heel lifts. We'll finish this one off the way we started. Again, the weight shift. That's it. Sinking into one heel, softly, knees also soft. And the kneecap drives forward in this one. I want you to notice the top of your thighs. That's it. And again, hips are square. We want to avoid, rocking out, okay? Nice and easy here. And only if you feel safe and you want to take that challenge, arms lift off, staying with the same movement in the lower body. Shoulders are also soft here. That's it. There you go. Let's get a couple more in just to keep those ankles moving. And maybe 1 more set each side. 1 more set each side. Nicely done. Beautiful. Now that the lower body's loosened up and warmed up, I'd like to build some strength into the lower body. But I'd also like to remind you that strength also can help us with our movement patterns. Now I have a foam block here. If you have one of these at home, that's fantastic. If you don't, a roll of paper towels will do the same benefit, have the same result. A box of tissues also, similar in size, similar in scale, because the goal here is to have the hands maybe shoulder width when you're holding on to the block. All right? The lower body focus for this is a bending and a lifting technique. Now we're going to use this foam block or you roll of paper towels. It's only ounces, so it's not too heavy for your lower back. So you get those patterns into your body and have safe and effective movement for the body for a bending and a lifting. Now I'm going to preview from the side the technique, and I'll show you the things to watch for. So I'm going to turn side on. First of all, I should let you know, the feet should be about the width of your shoulders, so you have that wide, stable base. Okay, so when you come to the side, weight in the heels as always. I'm going to take this block on the tall end, and I'm going to bend my knees to a squatting technique to drop the block to the floor, like this. I'm going to come back up. Okay, now I want you to notice here, as I come down to pick the block up, here's your lifting. I want you to notice where my chest and my head is. So as I come down, my chest and my torso is lifted. Now we're going to drop the block once more. See my knees bending? See my butt back and down? Now I'm going to show you an incorrect technique of bending and lifting, which most often leads to injury, especially in the lower back. All right, watch this. Can you see the difference in that technique? All right, so we want to avoid bending and using our back to pull and lift heavy objects like a laundry basket, a case of water, in your garden, your potted plants. We want to learn to bend and lift correctly using the muscles in the legs. All right, so for this one, like I mentioned earlier, come with me now. Take your feet about shoulder width. On the high end, the tall end of whatever item you're using, drop it to the floor and stand tall. So think about what we're doing here. Bend the knees, feel your body weight in your heels as you lift back up. All right, so let's put the focus into the legs. Bend the knees. Now feel your heels and open the knees. Do you see the difference? Bending to lift, chin and head above your heart when you bend forward. Bending and lifting. That's it. Here comes the pickup. Stand tall. Now as you bend your knees, I want you to press them slightly wide, maybe a 1/4 inch, that's all it is, to the pinky toe. That's it, a safe stance, safe bending technique, safe lifting technique. And we'll just come down one more time to pick it up. Beautiful. All right, shake it on out. If you need to shake it out. We're going to do that again, another round. All right. So as much time as you need to recover, you take, of course. You might notice your breathing has increased, and most often it should, because we're working the large muscles, the quadriceps, the hamstrings, the glutes, and in the back of your body. The large muscles need more blood flow, makes that heart pump faster. All right, now this is functional everyday life. You sit on a chair. Like I said earlier, pick up your laundry basket. All right, so let's try it again. When we're ready to join in, come with me. Feet shoulder width-ish. Body weight heels. All right, find the tall end of your item. Bend the knees to drop it. Where's your head? Is it above your heart? Check. Then you can come up. Come on down again. Pick it up. So let's engage that core now that we have the lower body technique down. Bending right here, scoop your belly. Hold that scoop as you stand tall. Come on down, bend the knees, body weight heels, scoop the belly. Hold that scoop as you lift. Yeah, work that six-pack, it's in there. Bending. Avoid the tipping forward. When we find fatigue, we tend to lose form. If you want to move slower than I'm moving, by all means. You want to stay with me? We'll build that leg strength. There you go. Let's just get one more in. Big bending of the knees. And we'll bend down and pick it up. All right, good job. Shake it out, shake it out. So you might feel muscle soreness the next day after you do this. You might feel muscle soreness here and in the front of the leg. You might feel muscle soreness in the hamstring, which is the back of the leg. That means the muscles are complaining. That means you did it right. You worked your muscles. All right, let's come on down. We can lose that block. So for our next bit, I'd like to keep the heart rate elevated where it is slightly, a little bit labored, just to loosen everything up. All right, so we'll come back once again to our safe place. Alternating heel tap, a shifting of the weights, upper body light, fluid. That's it. You want to get the arms in, you can. Add a little bop to it, you can. But what are we thinking, folks? Soft knees, soft landing, right? Breathing throughout this. This bit of a weight shift really helps to stimulate that body, wake that body up. That's it. This is something you can do at your stove if you wanted to. In your kitchen, washing dishes, just bop to it. There you go. Just a little more, just a little more. That's the way. All right. Let's just march it out. Let's march it out nice and easy. Now the march technique is much like before. The knee comes forward when we did those heel lifts. All right, so the legs are ready for this. So a little bit of a forward drive with the knee, a soft landing on eggshells. Once again, a soft landing on soft knees. Just march it out. You can get the arms in if you'd like. Check in with the breathing, so important. Breathe, please. That's it. Keep going, just a little more. Just a little more. Marching in place, going nowhere, but getting everywhere, right? All right, let's slow it down. Let's slow it down. All right, so quite often, I said earlier, we find ourselves in a seated position most of the day, in front of TV, in front of the computer, and that can lead to bad posture, poor posture. It can also lead to a rounding in the upper back and a rounding of the shoulders, which brings into a whole list of postural deviations that can occur as a trickle-down effect. All right, so rounding of the shoulders also leads to a rounding of the head. Quite often we're reading, cell phones, iPads, whatever we use. It just contributes to a distortion in the whole upper body. Now think about what happens here, how the front of my body tightens up if I'm always in this position. Now think about what's happening to the muscles in the upper back in this position. All right, so the focus here is to relax the shoulders back and down and open the chest, stretch the chest, and strengthen the muscles in the back of the body. All right, to pull the shoulders back and down and keep the posture in a safe place and keep the shoulder in a safe place. All right, and quite often, I'll do profile here. Quite often when we look down with reading or on the computer, it puts that rounded behavior into the spine, where your normal spine should have that natural curve in the back of the neck. All right, so the goal here is to release the tension in the front of the body while strengthening the muscles in the back of the body and relaxing those muscles in the back of the body, which are tense and tight, trying to do the work of the muscles that are in the front of the body. Now, if you've had surgical complications in the head and neck, if you've had surgery on the chest, axillary lymph nodes removed, again, the surgical procedures, this tightening, the scarring, adhesions can also pull your body forward. Okay, so you might feel that when we pull back, you might feel that that gentle stretching sensation, like we did earlier, is the goal. Never force a stretch. Okay, so let's stand tall. And if by this point you need to sit, of course, grab a chair and take a seat. If you want to come with me, one proper technique to always start is to check your posture. So once again, posture check. Weight in the heels, soft in the knees, square in the hips, chest lifted, collarbones lifted, chin lifted. But your shoulders are able to pull back, roll back, and drop down. Now I'm going to bring my elbows tight to my waist. You see that? Here's the side view. Tight to my waist. Hands can be relaxed. All right, so sink into those heels. So we're going to just gently take the arms wide. See my elbows? They stay tight to the waist. Now I want you to press the palms like you're squeezing a balloon in between your hands. Just come back shoulder width. Come again. Press the knuckles away. Lifting in the chest. Now once again, press the palms. Almost get the sensation even maybe of being underwater. That's it. So this motion here is rolling the shoulders back and down, getting into the upper back. But more importantly, like I said, if you've had surgical procedures in the front of the body, in the chest, this is strengthening the serratus muscle, which is alongside the rib cage, and helps to control the movement of the scapula and the shoulder joint. There you go. So open wide, open the shoulders, open the chest, press together. As you can see, it's a slow, controlled motion, but it's about the direction of force is key. So knuckles wide and palms press. That's it. Keep going. As we open wide, now that you have this movement pattern in place, I'd like you to find those shoulder blades behind. So as you open wide, shoulder blades squeeze tight to the spine and press. Let's get two more in, okay? Focus here on the shoulders. They should be relaxed. Focus here on your neck. It should be soft and neutral. Lift your chin. That's it. Simple movements. You can do this even at night in front of television. That's it. Watching the news at night. All right, shake it on down. So we'll take that same motion and increase the movement just a little bit. Okay, again, it depends on your range of motion in your shoulder. Stand tall. This time the palms are down by your side. Your thumbs will lead the move, but the direction of force, in fact, is forward. Okay, so we'll take the fingertips forward as the thumbs come wide. Now come back down. Imagine a capital V formation. It's the direction of force. Land shoulder width by your thighs. Come again. Fingertips forward, thumbs pull wide, capital V. At the moment I'm going about the shoulder width, shoulder height, excuse me. Okay, you can do the same. If you find your shoulders rounding forward to get there, you need to stay lower than your shoulders. Maybe a range similar to this would work for you until you improve and we work on that range of motion. All right, but for those of you that can come with me, once again, forward and wide. There you go. Now to get to the full range of motion, only if you can manage, come with me here. Full range of motion. That's it, feel the difference. And again, capital V formation to return back to the bottom. So bring the hands closer together. That's it. Now notice this shift. When we were here below the shoulders, it's more the behind the shoulder, the real deltoid. That's it, and the lower back, the upper back. Then we're going to bring it a little bit higher on the shoulders when you take the arms higher. Behind the shoulders, the traps, that's it, behind the neck. Let's do two more. If you can come with me overhead. If you can't come with me overhead, stay in your safe range. So again, the fingertips push forward, thumbs pull high and wide, and come on down. And one more time through, sink into the heels, the torso stays stable, lifting, pulling high and wide, and slowly coming on down. Yeah, okay, roll it out. We need to have one more movement, again, to add to that, okay? We're going to start the hands, working the same part of the body, of course. We're going to start the hands in the front. Now, a soft fist, we're going to cross at the wrist. And the same technique, pull wide, shoulder width, and as you come down, cross the hands at the wrist. That's it. And again, pull wide, forward, shoulder level, and cross at the wrist. You can cross any hand on top of the other, it's all good. But I want you to watch your hands. Even though we have a fist, please don't squeeze. I want the tension to be in the knuckles pulling forward and wide. Now you should be feeling this by now. Behind the shoulder, behind the armpit, the upper back. And if you do, you're doing it right. If you're not feeling it there, I want you to come lower, and I want you to pull stronger forward. Press the knuckles forward. That's it. Now, only if you can come with me, and if your shoulders and the range of motion allows, we're going to come here, expand overhead, and bring it on down. This is a move very commonly done with cables in the gym. That's it. That's the way. Let's just get two more in, overhead. And again, you have to work up to this overhead posture once you develop that full range of motion, which you will. Come on up. Big breath in, big breath out. Ah, good job. Roll it on out. Roll it on out. Now, you might have a little bit of soreness here, like I said, in the upper back area. That means you just did it right. All right? So by now that we stopped moving the larger muscles in the body, the lower body, we should be better with our breathing and have a more comfortable breathing pattern. We might also be able to speak comfortably. That means your heart rate has slowed down and you're ready to move on. So let's just stretch a little bit of what we worked today, okay? So I'd like you to take, let's take one arm out in front. I'm going to take the hand and clasp, but if you can manage to reverse clasp, that's ideal. And I want you to gently stretch that upper back by rolling the shoulders forward. Roll the shoulders forward. Feel that stretch across the upper back. Yeah. Now tuck your chin gently to release that tension that builds up in the neck from working the upper body. And once again, a counter stretch. We did this earlier. Pull the elbows wider, then back. Inhale, squeeze the shoulder blades. Exhale, release, hands come forward. Now you can clasp, or if you can manage, reverse clasp. Shoulder level if you can. Round forward until that stretch activates. When you feel the stretch, you pause. Drop your chin, drop your forehead. Releasing that neck. Opening wide, staying shoulder level, hands parallel to the floor. Again, elbows pull wide, gentle pressure back. It's more of a wide posture than behind. Yeah, come on down, shake it on out. Now let's begin. Let's end the way we began today, okay? So I'd like you just to have a little bit of a shoulder roll, up, back, and down. That's it. Inhaling and exhaling. Inhaling, rolling. Close your eyes for a moment if you like. Yeah. Now a little bit of pressure. The right amount of pressure would be the middle finger on the crown of your head. All right? Just tuck your chin, gentle pressure. Once again. Pay attention to what's happening here when you feel that stretch relax in the back of your neck. Your body's telling you it's had enough. That's it. I'd like to stretch into the lower body. I'd like to do a little bit of a hamstring stretch and a side body stretch. Okay, so for the hamstrings, we'll take one foot in front of the other. All right, the back knee should be a little soft. We're going to slide down to our thigh. And now press the back heel gently to the floor. Again, be careful not to lock out that knee. So gentle pressure on the thigh behind. Chin up, belly up. Now only if you can, straighten the front knee as best you can. More of a triangle technique in the legs, pyramid technique in the legs. So the top of the thighs have gentle pressure back. And again, since the chest is extended, the lower back also has that stretching and a nice flat back. Now the safest way to come out of here is to put your body weight in your heels and bend your knees and roll up, and let's just switch sides. So step back maybe 2 feet. All right, if your back toe wants to toe out slightly, that's fine. All right, keep the back heel lifted gently as we slide down. And then gently land that back heel. Gently pressing the thighs back, pressing in the hips back to straighten that front leg gently. Shoulders are soft. Identify your collarbones, press them forward to get that long spine. Yeah. That's it. Now again, the safest way to come out is to put your body weight in your heels, bend both knees to roll on up. Well, I thank you for that. Thank you for joining me today. I hope you have a wonderful day. Stay safe.